The goggles have been used before and they're all...
Back in March, Dr. Ann Gonzalez started hearing about PPE shortages in medical facilities across the country.
Some people were saying they were using the same, surgical mask for days on end. And I knew that we were eventually going to get in the same situation. Typically, these are disposable.
Sure enough, when she took inventory of the PPE at her office, she noticed they were running low.
These are the offices that were kind of left behind, especially independent, small offices. They don't have any affiliations with a large hospital that has deeper resources.
She made a post on Facebook asking for help, and the post led to a connection with the Carolina Textile District.
An isolation gown.
Leaders with the Carolina Textile District brought in Dr. Gonzalez and other healthcare providers to prototype masks and other materials.
It was a lot of fun because we tried on a lot of different masks. We would say, this is too big. She would take it into the factory. Someone would change it so it's smaller, bigger, and come back out and say, try this on now. So I'd never been involved in anything like that, but it was a lot of fun.
The medical professionals worked with the Carolina Textile District to figure out the most effective shapes, sizes, and materials.
We ordered these in June.
The finished product ended up in the hands of people all across the state, including employees at the NC Rural Center.
We felt like when they shifted their operations that we could certainly rely on them to provide a quality product for our organization and staff.
Those at the NC Rural Center say the Carolina Textile District's work is an example of the importance of partnerships, especially in the midst of a crisis.
For the success of the state and our regions and communities, we have to learn to do a better job of collaborating and building those relationships.
So I used this about 3 days ago.
And while the Carolina Textile District has not made any N95 masks often used in medical settings, the cloth masks and medical gowns are helping Dr. Gonzalez and her staff fight this virus.
The PPE was essential to making sure that healthcare workers could stay safe and continue to treat patients.